Today topic of discussion Spaulding classification. What is Spaulding? It was proposed Earl Spaulding in the year of 1957. So this theory was proposed by Earl Spaulding in the year of 1957. So it have this name based on degree of how much contamination it's having. So based on degree of how much contamination it's having, we are classified equipment class contamination, equipment decontamination. We can divided the device, the Spaulding classification according to the device or the surface can be divided into critical, semi-critical and non-critical. So this one we can divided the device, the Spaulding classification according to this device or the surface can be divided into critical, semi-critical and non-critical. So Spaulding believed that nature of disinfection would be understood in the basic of criteria critical, semi-critical and non-critical. So the first category is critical. We will call it as high critical. So according to this medical device that enter the sterile tissue, or vascular spaces, that is included in category critical. So sterile tissue or vascular spaces that is included in this category critical. Critical means all the medical device. Critical means all the medical device that are entering into the sterile tissue or vascular space. What level of microbicidal action is required? What is the level of microbicidal action is required? It kills all the microorganism. In case of this critical device, all the type of microbicidal action needed to kill all microorganism. So here we need sterilization as a method of decontamination. So we need sterilization as a method of decontamination in case of critical device. So what are the example of common item or equipment? Surgical instrument, then implants, prosthesis, scalpels, urinary catheter, needles and syringe, dressing, sutures, delivery set, dental instrument, then rigid bronchoscope and cystoscope, etc. So these are the common items or equipment. Whatever instrument which are entering into the sterile tissue or into that vascular space, they are considered as critical item and they need sterilization as a method of decontamination. So that is the critical. Second category is semi-critical. We will call it as intermediate. According to this classification, these include all the medical device. All medical devices in contact with the mucous membrane or non-intact skin. So all the medical device in contact with the mucous membrane or non-intact skin. Then what is the level of microbicidal action required? What is the level of microbicidal action is required here? Here it kill all microorganism. So microbicidal action Here it kill all form of microorganism except high number of bacterial spore. It will kill all microorganism except high number of bacterial spores. So here what is the method of decontamination? High level disinfection by heat or chemicals. So what is the method? High level disinfection by heat or chemicals. So this is all about semi-critical or intermediate. Medical devices in contact with the mucous membrane or non-intact skin kill all form of microorganism except bacterial spore. High level of disinfection by heat or chemicals. Example common items or equipment used in this intermediate level: respiratory therapy and anesthetic equipment, that endotracheal tube, then flexible endoscope, then vaginal speculum, reusable bedpan, urinal and patient bowls. Respiratory therapy, anesthetic equipment, then endotracheal tube, flexible endoscope, vaginal speculum, reusable bedpan, urinal and patient bowls. So these are all example of semi critical devices that coming under contact with that semi critical. Third category is this non critical or low. So according to this classification, how to define this one: items of contact with intact skin. So all devices that contact with intact skin. Then level of microbial action, kill vegetative bacterial, fungus and viruses. So this method will kill that microbicidal action, will kill spores, bacteria, fungus and viruses. Then method, what is the method of decontamination? Low level disinfection, cleaning. So example of common items or equipment: blood pressure cups, then blood pressure cup, stethoscope, ECG, then environmental surface including that operation tables, then other environmental surfaces. So this is the basic classification according to Spaulding classification: critical, semi-critical and non-critical items. So Spaulding classification: critical, object which enter sterile tissue or vascular systems or required sterilization. Then semi-critical, object that contact which mucous membrane, it required high level of disinfection but kill all level of bacterial spores. Then a non-critical object that contact intact skin but not mucous membrane and required low level disinfectant. Thanks for watching.